Hello friends, welcome to BMH Learning. In this video, I'm going to talk about cortisol test. So what is a cortisol test? It's a simple test that measures the levels of cortisol in your blood, urine or saliva. But most commonly used are the blood tests. What is this cortisol? Cortisol is actually a steroid hormone which is produced by adrenal glands. Whenever there is a threat, a hormone called ACTH is released in your brain. The ACTH then triggers the adrenal glands to produce cortisol and adrenaline. So we can say this chemical is the main hormone involved in the fight or flight response or in cases of stress. Now, there are many important roles played by this hormone. The most significant one we have already talked about, that is, it responds to stress. The hormone also helps in fighting against infection. It aids regulation of the blood sugar. The hormone helps to maintain blood pressure. Other than this, it also functions in metabolism regulation. Now let's talk about why we need this test, or we can say when this test is performed. So basically the cortisol level test is done to know whether your adrenal gland is functioning normally or not. So if it's not, either there are high levels or low levels of cortisol. So based upon this, the test is very helpful in diagnosing disorders of the adrenal gland. So there are mainly two disorders. First is Cushing Syndrome, a condition where your body makes a lot of cortisol. And the second one is Addison disease. This is opposite to the former. So your body makes very less cortisol. Let's suppose after the test you found high levels of cortisol in your blood. Depending on this, your doctor may think you are having Cushing syndrome because your body is making the cortisol in an amount more than it's required. Then he would go for the symptoms, and the symptoms can be obesity, and this would be especially in the torso region of your body. You must be having high blood pressure. There would be high blood sugar. You can also observe purple streaks on your stomach. Because of high cortisol, there would be skin bruises. You will feel weakness in your muscles. Apart from this, women may experience irregularity in menstrual periods and excess hairs on their face. So, if these symptoms are there, you must be suffering from Cushing syndrome. Now, if the cortisol levels are low, this would mean you are suffering from Addison disease. And the symptoms would be like weight loss, fatigue, muscle weakness, also abdominal pain, and there would be dark patches of skin, blood pressure would be low, you would be having nausea, vomiting and diarrhea. There would be a decrease in body hairs. Apart from these two conditions, the test can also help in diagnosing adrenal crisis, which is a life-threatening situation that happens when the cortisol levels become extremely low in your body. Symptoms include the blood pressure would be very low. You will experience severe vomiting and severe diarrhea. Because of severe vomiting and diarrhea, there would be intense dehydration. You will feel sudden and strong pain in the abdomen, lower back and legs. Other than this, loss of consciousness and confusion also. Regarding test results, one more thing I would like to tell you. If the cortisol results are not normal, that is, it may be a bit high or low, this does not necessarily mean you are having problem with adrenal glands or you are suffering from the diseases we talked about. There can be other factors which may be responsible for this. These include stress, infection, and also the pregnancy can affect your results. Also the birth control pills and some specific medicines can increase or decrease your cortisol levels. This was all. Thanks for watching.